34-year-old woman with a history of non-ischemic dilated cardiomyopathy underwent a successful orthotopic heart transplantation. She was initiated on a standard immunosuppression protocol and is merely ready for discharge from the hospital. Which of the following has been shown to improve outcomes post-heart transplantation in a RCT? And remember, non-ischemic DCM is the number one reason for heart transplantation right now in the world. And that itself is a question. And the only treatment that's been shown to improve outcomes after cardiac transplantation is going to be treatment with statins. And that is probably because statins can delay the onset of something called as cardiac allograft vasculopathy, and that's the reason. And apart from that, none of the other treatment, including beta blockers, colchicine, or aspirin, or antiplatelet therapy, immunosuppression, are shown to improve the overall outcomes after cardiac transplantation. Remember, repeated endomyocardial biopsies performed in a lot of centers to assess the presence or absence of rejection, but that's not shown to improve the outcome after cardiac transplantation. The right answer for this question is going to be option number A, starting treatment with statins.